Welcome, Jen. Can you tell us a bit about the White House Gender Policy Council, why it was created, and what your focus is as you launch?
I'd be happy to. Thanks so much for having me. The Gender Policy Council actually follows a number of other women and girls offices that have actually existed before in the White House. So in that sense, it's not new. There was, in fact, an Office of Women's Initiatives in the Clinton administration. I worked in the First Lady's office in the Clinton administration, and we sort of thought of ourselves as an adjunct working on a whole host of issues, which many people termed women's issues or gender issues. Fast forward a bit, although there have been similar offices in Republican administrations as well. But the most recent example was in the Obama administration, there was a White House Council on Women and Girls. And I worked actually really closely with Valerie Jarrett and Tina Chen, who led that office, to think about what worked and what might be different. So I would say there's sort of a couple of distinguishing factors. The first is, as you will note, it's not called a White House Council on Women and Girls, it's called a Gender Policy Council. And the reason for that is, while we are very much focused on women and girls and keep a laser focus on that, because in many places in the world, including here, there is discrimination simply because somebody is born a girl. And we don't want to lose that focus. On the other hand, it is a signal and a statement of the work we are doing to include gender more broadly. The second word that appears in our council's title, which was different, is policy. So, you know, the council's the previous councils have been much more focused on outreach. Not that they didn't do policy work, but they were much more focused on outside stakeholders. We do a lot of meeting and learning from and sharing our work with outside stakeholders of all kinds, whether that's advocacy groups and nonprofits, the philanthropy, the private sector, state, local, and tribal governments. But at base, that's in service of the work we do on policy. So similar to the National Economic Council or the Domestic Policy Council or the National Security Council, we're focused on a range of issues, which, as I said, some people still call women's issues. I don't, because they are core issues. And I know we're going to talk more about that, but you know, they're core economic issues or health issues. But that's the explanation for the change to the word policy. And then the only other thing I would note, which is really important, was really important to me in thinking about the genesis of this council, was that the work is both global and domestic. These are issues which literally cross borders. They don't stop at the border. So whether you're thinking about an issue like women's health or economic security or immigration, those are issues where there are implications, both globally and domestically. And while there are differences, and obviously the work is tailored to where you are doing it, there's more similarities, I think we've learned in the last 4 years than we might have even seen when it comes to thinking about women's rights and opportunities.
Thank you. That was great. And you honed in immediately on one of the key issues that we wanted to talk about today, which is the economic issues surrounding women's work, as it's often been defined in this country. And I think what we've seen definitely is that the pandemic has really exacerbated and spotlighted the huge economic barriers that so many women face, particularly women of color, particularly immigrant women, and the consequences that those barriers have for them, for our economy. And these are the women who work for Parent Child Plus, and they're the mothers who participate in the program. So not only with your Gender Policy Council lens, but the work you've done for your entire career, where do we go from here? What do we focus on to try to change some of these circumstances?
Yeah, you said that so well. I mean, I walk around saying we started with a health crisis, then there was an economic crisis, and then there was a caregiving crisis. And by the way, I think there's, you know, the other thing that that people have really started to recognize is this, not so much the issue of Parent Child Plus, but a real shadow pandemic of gender-based violence, which again, all of these things existed. All of these things were challenges for women, particularly women of color, as you just pointed out, for decades, for generations, probably. And what is new is only that they've gotten worse. and maybe in a way that has some positive benefit going forward, a little bit more visibility. So what was really hidden and seen in many cases as a private responsibility, if you take the example of caregiving, now you can't look away, right? We see the consequences of the lack of public policies to support caregivers, the implications when women are leaving the labor force, to take another example, in record numbers. We're back to the labor force participation rates of the late 1980s. So that is the consequence of the pandemic that we've all been living through. But it's also, sort of the chance going forward to actually really begin to address these issues. In the Biden administration, as you said, at the council, I spend much of my time working on these major pieces of legislation that we are trying to pass. Obviously, that goes way beyond the council. Really, that's obviously the focus of many people in the administration. But I think that where we go from here is sort of as I said, the recognition of what these longstanding barriers have been, and really an understanding that in order to address economic relief and economic recovery, we've got to address those barriers. And we can talk more, and I know we will, about the specifics of what that means, but I think sort of that's the moment we're in. And I really do, optimism seems like a strange word to use these days, but I am at least optimistic that we will make progress because of how dire the situation has been.
It is interesting to me how what some of us knew already, both as working mothers and as in the work that we've done over the decades, how important childcare is. And if there is a silver lining, maybe one thing is that we have really amplified for the entire country how important childcare is, because of the number of women who have dropped out of the workforce because they don't have access to it, can't afford it, can't find it. And we saw that with our own workforce during the pandemic, that when we did lose people, it was because they didn't have the childcare they needed to do a job that involved supporting and caring for other families. And that is a huge challenge. So let's talk a little bit about how does the thinking around some of the administration's plans on building an equitable economic recovery, how can that help support families with young children? Again, both the families who participate in Parent Child Plus, but so many of the families who work for the program as well. What are the components of the American Rescue Plan, the Family Plan, and some of the other administrative initiatives that are hopefully going to make some real change for these families?
Yeah. So I think, as you said, the American Rescue Plan, which obviously has passed and is already having real impact, some of the things that are in there, either directly or indirectly related to childcare. The first very directly related was this Childcare Stabilization Fund, which was $39 billion to go to childcare providers who, as we all saw, were among the most essential of the essential workers, right? And conversely, many forced to close during the pandemic. So that's really an effort to help childcare centers literally reopen, modernize them, and really put them on a stronger footing. And then you've got the other things that just will help families very directly, the $1,400 direct payments, obviously getting shots in arms so that we can all, as we are seeing now, really get back to what, is more normal. Although I keep saying we don't want normal, we want better than normal, right? We want that truly equitable recovery that you mentioned. And another important feature of the American Rescue Plan is, of course, the child tax credit, which the president has asked for additional funding through the American Families Plan to have it last longer, because it will expire at the end of the year, as you know. But that is already having real impact for literally putting money in the pockets of of families with children. And in fact, not the question you asked, but I do want to mention that, we're working really hard to have people, and I think the folks who both work at parent-child and who send their children are among the most important beneficiaries. So having people know that you don't have to file taxes to get this direct payment, and that you will get it monthly throughout the course of this year is something that we're really trying to get the message out about. Turn to child care for the moment, the American Families Plan, which, by the way, is we are working hard to try to pass at the moment. And what it would do is a number of different things. I mean, it includes universal pre-K, and it includes a number of provisions, both to make childcare more affordable for families, so that families would only spend up to 7% of their income on childcare, and ensure that all low-income families, again, particularly families of color, would be able to afford childcare for their children, particularly children under 5, where, as you know, it is the most expensive. But also to invest in the quality of that care. And I am talking to somebody who knows better than anyone why that investment is important, right? And I have been gratified and heartened that it feels like I hear other people citing back the research about how important investing in children in their earliest days is, not only for children and for educational outcomes, but also, and health outcomes, but also for the economy. So, what you've been doing for the last however many years is working. People are finally listening. So anyway, improving the quality of childcare, and importantly, to your point, investing in the childcare, the people who provide childcare, right, who have historically been underpaid and undervalued. So one of the features of the childcare provisions of the American Rescue Plan are that childcare workers would receive a $15 minimum wage, and that also they could receive the training that they need or want, so that they could, commensurate with like kindergarten teachers and elementary school teachers. If they wanted additional training, they would be compensated for their additional skills.
That's great. And you moved right into my next question. And just for the Parent-Child Plus audience, I think one of the things that Jen's touched on, which is so important, is the world of family childcare, which is a world in which we now do a fair amount of work supporting those care providers in the same way that we work one-on-one with parents, which has been the workforce that has been incredibly hard hit by the pandemic. It was very hard for a lot of those providers to stay in business. And some of these benefits are really helping them reopen. We've been seeing providers get financial influx from their states and localities that are helping them reopen. But you really hit on that issue around what we do to support women who come into the workforce without the traditional paper resume that is going to get them a high salary. So many of the women who are part of our workforce have faced systemic barriers around access to education, both because of their home language or because of the cost, because they need to work to support their family. But many of them have such powerful life experiences. They've overcome adversity. They've cared for their own and other families. They're engaged in their communities. They're community activists. And how do we bridge that gap to get them meaningful job opportunities that will pay them not only a living wage, but really a thriving wage that will enable them to support their families?
Yeah, I think there's, so much embedded in what you just said. And as you said, first and foremost, meeting people where they are, right? So just ensuring that if you are doing the job of taking care of our kids, or by the way, not so much the work you do, but so related is home and community-based care for disabled people or for elderly relatives, right? Another entire workforce where should be the most valued and historically have not. But ensuring that whatever somebody's level of education, and as you just so beautifully said, There are things that are so important to somebody being able to do their job well that don't appear on their resume, don't appear, with a degree stamped on a wall. So just ensuring the basic, which is that people who are doing these jobs are paid a decent wage, right? So ensuring that $15 minimum wage for the home and community-based healthcare workers, for the childcare workers, but then also, giving them the opportunity to get additional training. So another piece of the American Families Plan, which again, the president feels really strongly about, and by the way, the first lady feels really, really strongly about, is community college, right? 2 years of free community college, which could also be used at a historically Black university, to get additional education in whatever field somebody is interested in, but also the certification in childcare or early learning that will actually help them get, first of all, be really helpful to them doing their job, but also giving them that, that credential so that they can make more.
I think that's great and super important. What are the things that nonprofits and employers can do working together with the administration to further some of these initiatives? I know particularly for us, it is around the issue of, we're worried about retaining our workforce. There is a big demand now as we open up for retail workers and restaurant workers, and we're certainly hearing in a lot of the cities where we work that they're being paid, they're being offered salaries that are higher than most people in the caring professions have access to. And I know one of the issues that I've started to talk with some of our public funders about is, this may be the moment when we need to really think about both growing our programs, because we know that coming out of the pandemic, there are so many children who suffered through the isolation and trauma of the last year and a half and really need the kinds of supports that early childhood education provides if they're going to transition successfully to school. But we also really need to take care of this workforce, and that balance of how do we grow our supports for families, but also increase salaries and benefits for our workforce is a challenging one, and probably one that the for-profit, the government, and the not-for-profit sector need to engage in together.
Yeah, completely. I mean, one obviously big, as one of my former bosses used to say, big piece of work for this summer and beyond is to actually make that public policy change at the federal level, at the state level, at the local level, right? And that's a hugely important piece. There's the voice of people who have been doing the work, the voice of people who, as I said, at the outset of this conversation, I feel like finally there's a visibility and an understanding of sort of the level of expertise that people who are doing the work that, your organization does, that people who are doing home health care, they're being respected, their voice and their history is being respected in a different way. And so I think that's, separate and apart from the work you go do every day, and far be it from me to tell somebody to take something else on at this point, because that work is plenty. But that voice in the public policy debate is incredibly important. And so I would just encourage everybody to really be vocal. Really, now is the time. As we've been talking about the pandemic, the opportunity that the pandemic presents is, that, as I keep saying, an emergency demands big structural change. My only fear, I walk around worrying perversely, that when that sort of starts to fade, which God willing, it is beginning to do now and will continue to do, we might forget, right? We might forget that when we didn't have childcare, we couldn't go to work and women left the labor force, right? And it's, already going to take 2 years to recover economically, at least. But if it gives us anything, it gives us the opportunity to make these long overdue changes, which the people you work with have known for a long time are the exact changes this country needs to make. And we didn't even talk about paid leave, but that's another example. which is that, we're literally one of, I think we're down to 2 countries in the world that has no paid family or medical leave of any kind. Again, now is the time. If we don't do it now, I don't know when we do it. And it's, if we didn't know a year and a half ago how important it is to take a paid sick day or to get family leave to take care of yourself or an elderly or any age relative, or to take care of a new child, we know it now.
Well, I hope that we know it now.
I hope that we know it now.
The message is absolutely right. We want to get past the pandemic. We want people to no longer be talking only on Zoom, but start to talk to each other in person. But we also don't want to forget these really important lessons that we've learned. And we don't want to take the spotlight off the caregiving workforce and how important they were to getting us through this challenge, but how even more important they can be to helping us to grow and thrive and get to that new normal that you so optimistically said will be our next place. So I can guarantee you that you all will be seeing Parent Child Plus folks in Washington, either via Zoom for now or in person, but continuing to carry that message forward. So Jen Klein, thank you so much for talking with me today. And we look forward to continuing this conversation.
Thank you. Thank you for today, but also even more importantly, for all the work you do every other day.